Infant health and mortality is an ongoing concern in Oklahoma. The state ranks 43rd in infant and child health in the 2013 Kids Count report presented by the Annie E. Casey Foundation. But now baby-friendly hospitals are working to improve that ranking by changing hospital procedures and emphasizing the importance of breastfeeding.
Gracie May is just 3 days old. She's Deborah Jean Greco's first baby.
She was 7 pounds, 8 ounces, 20.5 inches.
Gracie May was born at the Claremore Indian Hospital. It's the first hospital in Oklahoma to earn accreditation as a baby-friendly facility. 8 others are working on accreditation. Baby-friendly standards are set by the World Health Organization to improve the health of babies and mothers by encouraging and supporting breastfeeding for a baby's first 6 months to a year.
If it gets too hard, sometimes that formula looks pretty easy.
Baby-friendly accreditation began more than 2 decades ago. Maternity hospitals in more than 125 countries have all or most of their maternity hospitals accredited. The U.S. lags far behind. Only 7% have accreditation. So what does baby-friendly accreditation mean? State Health Department WIC breastfeeding coordinator Roseanne Smith says it begins with changing hospital policies, practices, and training.
Their staff is educated on breastfeeding. They're going to support the mother's breastfeeding goals. They're going to have staff that is educated on breastfeeding, just to help really encourage that mom.
Claremore Indian Hospital OB nurse and board-certified lactation consultant Jenna Meyer says encouragement begins at birth, when babies get skin-to-skin contact with mothers until the first feeding is done.
Almost 90% of our babies, even in the OR, go skin to skin within 5 minutes after birth. That's huge. That didn't happen, any time in the past, and that's all come together in the last year.
Jean Greco delivered her daughter by C-section, but still got to cuddle her immediately.
It's pretty awesome. I like it a lot. They didn't have it when my sister had my niece, so I think it was pretty cool. They put her on my chest like right after she was born and everything. I got to hold her and everything, so it was pretty cool.
But we continue to encourage that contact throughout the first year of life. And that allows mom and baby's heartbeat to regulate to each other. It helps baby's brain development. It helps them maintain their sugars and their temperature. And it helps mom connect with that baby.
It's like the best feeling ever.
After delivery, baby stays with mom instead of in a nursery.
They didn't do that either when they had her, my sister had her niece. So she was like, "You're lucky you get to keep her in the room all night."
Doing that alone really helped our breastfeeding rates increase.
Before baby's first?
You were lucky to see 30% moms leaving exclusive breastfeeding.
Now,
we have around 85% initiation rate when they come into the hospital, and about 65 to, it varies month to month, but we can say around 60 to 70% of those moms leave exclusively breastfeeding.
To be accredited, hospitals can't accept free or low-cost baby formula and bottles or use pacifiers. They also can't provide formula gift baskets. The State Health Department wants hospitals to become accredited because mothers in Oklahoma have a poor track record of breastfeeding beyond baby's first few weeks of life.
We're doing great on initiation, but a lot of our moms are not able to complete their breastfeeding goals.
Hard, but I'm not giving up. They keep me motivated, believe me. They're a lot of help.
How long do you plan on breastfeeding?
For at least 6 months.
The annual Centers for Disease Control breastfeeding report card issued July 30th shows only 40% of Oklahoma mothers breastfeed for 6 months.
Which is actually up from last year. Last year was only 33% of our moms at 6 months were still breastfeeding. But unfortunately, when we get to 12 months, we drop way down to 14%. So even though it's recommended to breastfeed your baby up to a year, our moms are not being able to reach their goals.
A Harvard University study published this week found children breastfed 6 months or longer have better language skills at age 3 and higher IQ scores at age 7. The State Health Department reports infants exclusively breastfed for 6 months or longer are less likely to be obese or have types 1 and 2 diabetes, Crohn's disease, ulcerative colitis, and some childhood lymphomas and leukemia. Along with pushing hospitals to become baby-friendly, the State Health Department provides nursing mothers with several support options, no matter where they gave birth. The county health departments and WIC clinics promote awareness about the benefits of breastfeeding and the availability of peer counselors to help moms successfully breastfeed. There's also a breastfeeding hotline moms can call to help ensure they're able to nurse for 6 months to a year and give their baby all the benefits of breast milk.